Good afternoon, ladies. It is my privilege today to be able to speak to you about the history of Crouse Hospital here in Syracuse, New York today. I can remember ever since I was a small child, I've always wanted to work for Crouse Hospital. My mother has been a nurse at Crouse for 35 plus years, and I remember that she always used to bring me to work with her on Bring Your Kid to Work Day. I remember always being fascinated and intrigued by the way that the hospital worked, and I knew that one day I would want to work for Crouse Hospital, just as my mother. Today, Crouse Hospital is one of the most technologically advanced, innovative, and accredited hospitals in the central New York area. Every year, Crouse Hospital treats tens of thousands of patients from all over the state of New York and delivers more babies than any other hospital in the area. They deliver approximately 4,200 babies at Crouse every year. Let's go back in history a little bit. We're going to go back to 1887. In 1887, the Syracuse Women's Hospital and Training Center for Nurses was founded. Fast forward a little bit to 1912, the Crouse Irving Hospital opened its doors to the public in Syracuse. This is a picture of Crouse Irving Hospital back in 1912 when it was founded. In 1913, the Crouse Irving Hospital School of Nursing opened. In 1929, the Syracuse Women's Hospital was renamed the Syracuse Memorial Hospital and started admitting male patients for the first time. In 1930, Crouse Irving Hospital was the first hospital in the region to establish a physical therapy department. And in 1942, Crouse Irving Hospital implemented what was at the present time a state-of-the-art admitting and record system that would soon become a model for hospitals all over the country. In 1958, Crouse Irving becomes the first hospital in the region to offer pediatric cardiac catheterization services. And soon after, in 1960, Crouse Irving opens the region's first intensive care unit, or ICU, and the region's first operating rooms. This is a picture of one of the first operating rooms they ever had at Crouse Irving Hospital. If you notice in this picture that only the doctors are wearing face masks while treating the patient.
You are the patient, Mommy.
In 1963, Crouse Irving Hospital opened New York State's first clinic for the treatment of alcoholism and drug abuse. In 1966, Crouse Irving opens the first coronary care unit in the region. 1968, Crouse Irving Hospital and Syracuse Memorial Hospital merge to become Crouse Irving Memorial Hospital. In 1972, a massive hospital expansion begins. They began building a 6th-floor Irving unit, which is a building that was completely separate from the original hospital building. 1976, the hospital's very first parking garage and physician's office building is constructed. The Crouse one-day surgery program opens in the physician's office building, and this one-day surgery program is one of the first of its kind in the entire country and the very first to open in central New York. In 1987, because of increased patient and physician demand for this one-day surgery program, Crouse opens their second one-day surgery center, known as the Madison Irving Surgery Center. Shortly after, 3 more stories are added to the new Irving unit of the hospital to accommodate the new labor and delivery floors and the new neonatal intensive care unit, or NICU, which is currently one of the top-rated NICUs in all of New York State. In 1994, Crouse became the first hospital in the region to begin offering non-surgical breast biopsy procedures, and also becomes the first hospital in the region to screen all of their newborns for newborn hearing loss. In 1996, Crouse Irving Memorial Hospital is shortened to its current name, which is simply Crouse Hospital. In 1998, Crouse is awarded accreditation with commendation status by the Joint Commission on the Accreditation of Healthcare Organizations, otherwise known as JCAHO. 1999, Crouse opens their new Kinzel Family Maternity Center on the new 7th, 8th, and 9th floors of the Irving unit of the hospital, which provides a more technologically advanced and home-like comfort for birthing mothers and their families. Crouse is also awarded the Company with Heart Award by the American Heart Association that year. The year 2000, Crouse opens the region's most up-to-date and state-of-the-art cardiac care center in the entire Central New York region. 2001, Crouse's intensive care unit is voted one of the top 100 in the entire country. The hospital's emergency department was also voted a VHA Incorporated Leadership Award finalist. In 2002, Crouse is the first hospital in the region to perform surgical cardiac procedures to close holes in the hearts of children. In 2005, JCAHO awards Crouse as having the best clinical performance locally in the areas of heart attack, heart failure, and pneumonia care. In 2008 was a very successful year for the hospital. Crouse received multiple awards that year, including the Optimus Award for General Excellence from Workforce Management magazine. Crouse was the first hospital in all of the United States to win this award. Crouse received the Most Improved, Most Wired Award from Hospital and Health Networks magazine. They also received the Employer of Distinction Award from the Central New York chapter of Society of Human Resources Management. In 2009, construction of the new state-of-the-art Whitting Surgical Center begins. 2010, Crouse became a nationally accredited chest pain center and becomes the only Central New York hospital to achieve the Gold Plus status from the American Heart Association. The new Whitting Surgery Center opens its first 7 state-of-the-art operating suites. This is an example of what one of our operating suites currently looks like. Currently, in 2011, the Whitting Surgery Center has recently opened another 4 operating suites, bringing that to a grand total of 11. They've opened a brand new patient holding area, and a newly expanded recovery room is currently being worked on. The construction currently continues in the Whitting Surgery Center, and plans are currently in place to construct a much more state-of-the-art one-day surgery center inside of the hospital, and this expansion is expected to be finished in March of 2012. Surgery today.
That's it? That's it.
Crouse Hospital currently continues their high standard of professionalism and success by receiving numerous accreditations and awards by multiple organizations. And I'm sure that they will have much continued success in the future. Thank you very much, ladies.
Look at, can you see my Barbie, Mama?